My question is, what has been the most effective approach to treating cystic adult acne, including supplements, superfoods, and oils? Okay, this is an interesting one, and acne like this is generated out of the gastrointestinal tract. If we've had long-term bioterrain, that means the bacterial levels within the gastrointestinal tract that have been skewed, we end up not being able to nourish the rest of the body well. And in part, what occurs is that the area on our faces are most affected. There are neurological activities that occur between the area just below the eye, the lower cheek around the jaw, and the large and small intestine. So it's a direct line, we should say, like a highway that runs up and down there. If a person cleans up their gastrointestinal tract, and in some cases they may want to go to a professional colonic therapist who's wise enough never to do a colonic, never to do an enema, without following it up with a wheatgrass implant, to rekindle the electrolytes, the minerals that propel the electrical frequency of all of the cells in your body. And then after you do that and you start to clean it up, make sure you take an extremely strong probiotic. There are many good ones worldwide on the market today. Never just take an acidophilus, the type of thing you'd find in yogurt or kefir. What you would do is get a multiple bacteria that pretty much mimics what we find in a healthy gastrointestinal tract. Now, the state of the art of this now, we've been using it at Hippocrates for about a year, is the Sagan product. And the Sagan product is out of Japan. It is by far the state of the art. I strongly suggest if you have IBS, irritable bowel syndrome, Crohn's disease, diverticulosis, diverticulitis, any of these issues, that you would go directly to that. Problem with that one is pretty hefty in cost because it's a Japanese product. But boy, that's been remarkable. But take something of that level or something of fine quality that you get out of your local health markets and start to employ that. Next, what you need to do is you need to start to vaporize your face and allow the pores to open up, because the pores inherently and naturally close and start to create cystic problems and acne as we know it. What you put into that is spearmint and wintergreen oil, 2 drops of each in the vaporizer. Allow that heat to come up and open up the pores. After that happens, do this at night, and if you're at home, do it twice a day, but at least at night before you go to bed. Then wash your face off with an extremely good non-soap antiseptic cleaner. There's many of these in health stores or online. You'll find things like the Jolique product, makes an excellent one with tea tree oil and lemon oil in it. It's an antiseptic, but it's not a soap that dries out your face. And literally, most soaps would contribute to acne because of the fats in them. You wash your face with that. Then go out and get an edible form of clay, an edible form of green clay, and gently apply that to the face. If you have an esthetician, a skin specialist in your area that has what we would call great perseverance and astute knowledge, she or he could literally go with a little tiny magnifying glass and slowly but surely take out the blackheads, or the plugs, we should say, in the most affected areas. So that would be the most rapid way to do it. When I've seen this done by efficient cosmetic estheticians, it's almost remarkable how rapidly this acne goes away. Barring that, though, just a prolonged use of cleansing of the intestinal tract, of course, adapting the Hippocrates-type lifestyle, of course, staying away from fats and things that are going to contribute to it, and doing the vaporizing, that alone is going to put weight in. But boy, you can speed it up by tenfold if you could find these types of estheticians. The problem is it takes a couple of hours a session, and often several sessions, depending upon how dynamic the problem is, to make it really, really work well. You have to know that everything relates with everything else anatomically. that there's nothing that sits off on its own. It's not acne alone. It came from somewhere else. Hormones have something to do with this, but as we mature, it's less of a hormonal activity. That's more of a teenage activity. The oils you ask about, should you take any oil? Well, frankly, most oils would be very bad for you in this one. If you were to take any oil, and this wouldn't be specifically to help the acne, it would be better to take this. It would be hemp oil, walnut oil, flax oil, that level. God forbid you ever took a fish oil, that would contribute to it.